Hello people, in this video let us look at this textbook of Microbiology by Ananthanarayan and Paniker. So this is your textbook for MBBS for microbiology. Microbiology is all about bacteria, virus, and there is a separate book for parasites, that is parasitology. So everything that you look under the microscope, causative organisms for many diseases, right? So if you give your blood sample or a urine sample, these people should be able to tell you which organism it is and to which antibiotic it is susceptible, so that you can treat the patient. So that is the whole concept of microbiology. So once you know how these bacteria or virus they multiply, or how the disease progression happens, the pathogenesis, all that if you understand, you'll be able to see the you can give the suspected organism in your diagnosis. Am I saying it correctly? So basically you have your blood, let us say you are giving the sample to the microbiologist, they will tell you which organism is there by growing it on culture media, etc. So look at this. This is all bacteriology, systemic bacteriology, then virology. Then they're talking about parasitology also here, right? Then disinfection, how you can do that. Also they're covering here, how you can kill these organisms, right? Then immunology also is covered in microbiology. So autoimmune disorders, hypersensitivity, etc. Then coming here, as specific systems, what can affect, like central nervous system infections, like can be your meningococcus, and anything that causes meningitis, could be your tuberculosis bacteria also, could be virus, right, could be even parasites, right? So you should know all that. Then UTIs, right? UTIs are caused by bacteria. Very commonly, what can it be? It can be your staphylococcus, is it? Klebsiella. Some complicated ones also can cause your UTIs, etc. So that is what is there in this book. Contents. So here they are talking about this. What is this? They have kept something here, and they have kept. What do you think this is? This is a Macintosh anaerobic jar. So this is basically to grow the organism then, right? So this is an anaerobic culture method. So you're going to keep the sample here and see how it grows, how it is going to produce gas also. And here they are showing you how they're going to streak. So they're going to take the sample and streak it on this culture media. And this is how it looks after it has grown for 2 days. So after 1 day they will read it, after 2 days they will read it, right? They will put it in an incubator and read it. So basically after some days it will completely grow. So they want to check after 1 day and 2 days. That is when they know what pattern it forms. Is there a halo around these growths, etc., by which they can know which organism it is, right? That's very interesting. Very interesting. So not just about growing these organisms, you can even find the chemical that these produce. So there are some biochemical tests also that you can do. Look at this here. They're talking about lateral immunoassay, not fluorescent, lateral flow immunoassay, right? So they're putting that test serum here. What is serum? It doesn't have the cells, right? So that's what they're putting here on the sample pad, and then they're reading the windows. ELISA is very, very important, guys, for diseases like hepatitis, etc. So go to your microbiology lab and look at, they have all these very rapid kits they have nowadays. They just put a sample and wait for 1 minute and get the reading whether the person is HIV positive or hepatitis B positive, etc. Even Vidal is done like that, right? And then what they do, then after that they do the titers also. So at the end of every chapter focus, guys, we're looking at this textbook, Ananthanarayan and Paniker textbook of microbiology. So at the end of every chapter, what are they giving you? They're giving you the key points, which is very, very nice. I like it like that. At the end of the chapter, some summary, and then they're giving you some important questions that you should know, and then MCQs. So where are the answers to these MCQs? We'll have to look at them. So the book as such looks neat and clean, but I did not read this book. I read Apurva Shastri. You will be surprised to know that there are so many bacteria, so many virus, right? What are you looking at here? A polio afflicted individual. So basically polio is caused by what? Virus, okay? Polio virus. About polio, basically you should know that it is eliminated in India, right? That you should know. Then coming to rabies, rabies is also very important. If you know polio, rabies and these diseases, no, you will pass in community medicine also. So this is the rabies and how it ascends, right? So now let us say this dog has bit this leg. What happens then? It reaches the spinal cord, and then where is it reaching? It reaches the brain. See, they've shown an up arrow here, right? So this is all about the rabies. Rabies is 100% fatal. That's what we read. Sadly, there is no dog control in India. Failed animal birth control is there though. Now, what else? They're talking about some treatment of some disease also, which is very good, which will usually be antibiotics, okay, because this is microbiology. Viral, everything will be self-limiting. Guys, focus here. Virus, mostly everything will be self-limiting, though you have antivirals like acyclovir, etc. For bacteria, you will give specific antibiotics, which you think will be sensitive, or you will give broad spectrum. Empirical therapy you will give also sometimes if you are not ready to wait for the culture report. So what is this diagram here? Intravaginal coloscopic view of female patient cervix showing the characteristic strawberry appearance of Trichomonas vaginalis infection. Wait, then we are talking about parasites here. Okay, then there's a case review also here, which is nice, right? What are the answers to this? They did not mention the answers to this case study. Okay. There is a chapter here called as opportunistic infections. This we will see in HIV infected people, etc., or immunocompromised people, right? See, you have cytomegalovirus, Epstein-Barr virus, fungal infections, etc. Actually, they are saying that Epstein-Barr virus causes immunosuppression. Okay. Some national health programs also they have covered here. National TB elimination program, all that you should know. Right? See, first there will be control program, then it will become elimination program, then it will become eradication. Currently, looks like we are in elimination. Okay. And here are the answers for the MCQs. However, they did not give answers for the clinical cases. So this is the textbook of Microbiology by Ananthanarayan and Paniker. Okay. See you people. Bye bye.